Dion Aaron with Rivendell Behavioral Health Services of Arkansas joins us for Therapeutic Thursday to talk about the many ways social workers can help Arkansans. Dion, it's always so good to see you, and I love this topic because social work is such a broad career field, but so helpful too. So let's just define what exactly is a social worker.
A social worker is a trained professional who helps people and communities overcome challenges in our lives. Now, the core mission is to basically improve human well-being, help meet basic human needs of all people, and empower vulnerable populations. So we do that we have a role in advocating for communities, families, and individuals, and we help our society basically try to reach our full potential. So March is National Social Work Month, and for 2026, the theme is social workers uplift, defend, and transform.
Oh yeah, what a great theme. Let's talk specifically right here at home. How do social workers help Arkansans?
Okay, so in keeping with our theme, uplifting focuses on promoting wellness and growth. Defending is advocating for human rights and supporting all people. Transforming highlights the power of social workers to reshape lives and create lasting positive changes. But really what we do is advocate during mental health crisis, support funding for social programs, focus on bringing people together so they can find common ground and work to improve the lives of all people. Now, one of the biggest issues in Arkansas has been suicide. Arkansas has experienced a 12% rise in suicide between 2022 and 2023. And in the state, we've had a 48.5% increase in suicide over the past 20 years.
Oh my goodness.
I know. And suicide rate is the second leading cause of death for Arkansans ages 13 through 19. So social workers help get people the mental health support they need, connecting them to suicide prevention experts, getting them to support, getting them to resources, and actually getting them to the treatment that they benefit from.
Where would we actually get to meet a social worker? Where do they tend to work at?
Well, fortunately, we work local, state, and federal. We work in all aspects of society, working with veterans and active duty members in the military, in schools, social service and child welfare agencies, in adoption and foster care, in substance abuse, doing mental health care, in hospitals. We do therapy in private practice, work in community health centers, we work in correctional facilities, and more.
Yeah, when my son was in the hospital a year ago, we met with several social workers, and wow, they were so helpful for when you're in such a situation that you don't know where to start and begin this journey, that they just they're holding your hand every step of the way. So I personally have been affected by a social worker, and I thank you for the work that you do. But what is Rivendell doing specifically to honor Social Work Month?
Right now, we're educating the public about the contributions of the profession. We honor social workers actually year-round by providing trauma-informed care environment for our patients, their families, and our staff. We know that most people will have some kind of trauma in their life at some point. So basically some stressful thing that just overwhelms them. They can't even cope with it. So at Rivendell, we help individuals build effective tools for helping to manage those emotions, that behavior, and relationships. They learn and practice the skills in group therapy, individual, doing creative activities, journaling, to help them build the tools they need to cope with it. You can contact Rivendell at 1-800-264-5640 or call 501-316-1255 for a level of care assessment 24 hours per day, 7 days per week if you need help and support. We provide inpatient care for children, teens, and adults, as well as an extended stay program for adolescent males. Our adult outpatient services include partial hospitalization and intensive outpatient therapy for those who need structured treatment but return home daily. We now offer Saturday programming, which is our intensive outpatient program, to better accommodate patients who fit their schedules.
Sure, Dion, always appreciate the work that you do and what you bring to the show. Thank you so much for joining us today. I really appreciate it. We'll have more Channel 7 News right after this.